The pain in your upper back is not random. This is the result of how your shoulder blade moves or doesn't move. And I'm going to break it down today exactly why it happens and the exercises that will finally help you fix this problem for yourself. Let's get into it. Ever feel that nagging knot between your shoulder blades or that tight spot near the upper inside corner of that shoulder that never seems to release? Whether you're a desk worker sitting all day or an athlete who trains hard but cannot build the back strength that you want and still has that pain complaint up there, this is one of the most common complaints that I see in the clinic. And today I want to go over exactly why this happens and some exercises that can help you fix this issue for yourself. Welcome back to my channel. My name is Dr. Rachel Gilmore, and I am a licensed doctor of chiropractic and a movement and resilience expert. I have been practicing for the past 5 years and have been in the fitness industry for the past 13 plus years. I've been a personal trainer in all sorts of roles. I've also been boxing for more than 5 years and have been able to practice every day as a practitioner for 10-hour days without having pain or injury. So first, let's break down the anatomy of the area and what contributes to this problem. The upper medial scapular region is one of the busiest intersections in your body. There are about 15 different muscles that attach in this area and around the scapula. The main ones that attach to the scapula include the levator scapula, the trapezius, and the rhomboids major and minor. And if the scapula isn't moving through its full range of motion, including upward rotation, downward rotation, elevation and depression, protraction and retraction, plus anterior and posterior tilt, that area can get locked down, feeling tight, overworked, and stretching it only gives temporary relief and is not going to actually fix the problem that you're having. So your shoulder blade does not move alone. This is a coupled motion system where the rib cage, the scapula, the clavicle, and the humerus all have to be moving together in rhythm. And when this rhythm breaks down, muscles like the levator scapula and the upper traps begin overworking, and the stabilizers like the serratus anterior and the lower traps aren't working hard enough to counterbalance these motions like upward elevation that we find ourselves in more often. That a lot of people find themselves in that upward elevation more often than not, and they are not training that downward motion of the scapula where we're actually drawing our shoulder blades down our back and utilizing the full motion of those lower traps, your lats, and the stabilizer muscles that are in the posterior shoulder girdle. If you find yourself in forward posture a lot of the time, whether you're sitting at a desk all day long or whether you're a bodybuilder that trains your chest and that pushing motion more than you work on stabilizing the shoulder blades and actually moving through that full range of motion of your shoulder, you're going to find yourself tighter in the front and having more of what we call that impingement syndrome. So when you try to raise your arm up overhead, you can't access the full range of motion of your shoulder to be able to actually utilize that full motion. That can contribute to things like rotator cuff tears, labral tears, and other issues that we do not want to have to tackle. So if we work on actually utilizing that range of motion of the shoulder blade to actually use those lower traps and those stabilizer muscles, then you won't have as much risk of injury later on in your life that we'll have to deal with. Now, here's where most people miss the mark. You need a mind-muscle connection with this area of your back, including your lower traps and those other stabilizer muscles. Now, this is not just a gym phrase. This is actual neuroscience. The motor cortex controls voluntary movement, and your somatosensory cortex in your brain handles awareness of that movement. So when you slow down and actually focus on that glide and that motion upward and down, forward and backward of your scapula and actually feel the right muscles working, then you are literally training your brain to fire those stabilizers better to protect your shoulders. I want to go through a few exercises that I use with patients and athletes that help you retrain a different scapular motion. So we're going to go through protraction, retraction of the shoulder blade, elevation and depression of the shoulder blade, and then another movement or two to try to help you activate those lower traps and those stabilizer muscles that help your shoulder function better. So the first exercise we're going to go through is going to be the scapular elevation and depression. And this can be an awesome exercise that can prep you for things like a pull-up or a lat pull down, where you are utilizing the full extent of your back muscles and really needing that depression of those shoulder blades to engage those lower traps and those upper lat muscles when you do the movement. We're setting up for this exercise. We're going to set up just like we would for a lat pull down in the seated position, having arms all the way over, all the way extended overhead. So you don't want to bend those elbows because that is going to defeat the purpose of the exercise that we're actually doing. So what you're going to want to do is you're going to want to pull all the way up through those shoulder blades, elevating those upper traps and those shoulder blades, letting them rise all the way up to your ears. And you're going to imagine you're going to pull those shoulder blades down to your back pocket, not arching the back, keeping a nice rib cage stack in and giving it a nice downward motion of the shoulder blade as you do this move. Another favorite exercise of mine is going to be the scapular protraction retraction to prep you for the neutral grip row or any type of row that you are doing. A lot of people make the mistake where they go in to do the row and they stay in that retracted position instead of actually letting the shoulder blades fully move through that range of motion prior to doing the exercise. So you're shorting yourself by not actually going through the full range of motion, which we know mobility is required to access the stability and in order to build strength on top of it in those motions. Remember, this is a complex. This is something that works together, and we have to utilize the full motion of that serratus that works to stabilize in that forward motion contraction here, that rib cage stack that we have access to, and the full complex of our back muscles as we go into that motion. So remember where you should be feeling that motion when you are doing the exercise. I see this a lot of the time with the bodybuilder community and with people who are trying to push a ton of weight. They stay in that shortened position instead of actually utilizing their full range of motion for the joint that they are trying to move and for the muscles that they are trying to work. The first step, our rib cage, is super important in doing this motion, and the rib cage does rotate in order to do this motion. You have that thoracic mobility as well as the shoulder motion when you are doing this to get the full range of motion of the exercise. So what we're going to do is we're going to let our arm go all the way forward, let that serratus contract, really get that mind muscle connection, make sure we have that rib cage stack going on and that core engaged. Then when you go to pull back, you're going to imagine the back of your shoulder blades squeezing in and pulling back before we go into that row motion. Another one of my favorites that I'm not going to demonstrate today is a W raise that is best utilized with some plates or to warm up in your shoulder motion. So stay tuned for another video and we will talk about that one at a later date. Now, a lot of people love a Y raise or a wall walk to engage some of these muscles, but I find it really difficult for people to actually engage the muscles if they can't feel that connection or if they don't know what they're supposed to feel. So I'm going to show you one of my favorite exercises for engaging the lower traps and prepping you for being able to actually feel the motion of that exercise that is the Y raise. So because I know that I personally have a little bit of shoulder blade instability, as you've probably seen in this video today, because of my asymmetry, and I see this all the time in the clinic, and I saw this in my previous business as well too. So we're going to go over the high pull to engage those low traps and those upper lats in the motion that we're trying to do. Okay, so for this exercise, and because I've got some different equipment here, you can actually set this up in a tall kneeling position or a half kneeling where you've got one knee down and one knee elevated, or I'm going to set this up where I'm pulling back just a little bit to be able to utilize that cable on one side versus the other side, because we want to make sure we're working both sides of our body so that we can really get the full benefit and see where we need to work the most. So we're going to fully extend that arm out to the side, and then we're going to pull down with that elbow getting close to that rib cage here, maintaining that stack of the rib cage, not arching that back too much, and using those lower lats to engage there. So fully lengthen all the way through, and then really use those lower traps to pull into that exercise. Another exercise that I love to do is going to be to teach this protraction, retraction. So the retraction and then protraction motion of the shoulder blades is going to be the elevated bear position, protraction, retraction. So think of those shoulder blades in your face moving towards that bench. You're going to lock out that core having those knees off the ground. You can also do this in a quadruped position with hands and knees on the ground, or in a push-up position. I find this difficult for people to maintain the full push-up position and really focus on their shoulder blades. So I really like to get them into a modified bear position to do this exercise. So you are going to be pulling those shoulder blades together and really squeezing that penny in between the shoulder blades, getting your face closer towards that bench, and then pushing away from the bench, pushing the face away from the bench, keeping that rib cage engaged as you do this motion. So remember, next time you have that nagging pain in the upper back, the fix isn't endless stretching or running to the chiropractor. It is retraining the entire system with control, stability, and mind muscle awareness to be able to build that strength in those areas. If this video hit home with you, make sure you drop a like below and you subscribe to the channel for more videos just like this, tackling different areas on your body and different problems that you may have. So if you're watching this and you happen to have shoulder pain or a shoulder issue, or you really resonate with this, or you have a question about something, drop me a comment below. I would love to chat and love to get more video ideas from you guys on what you want to see. Make sure you subscribe, like this video, drop a comment, and follow for more information over on Instagram at Dr. Rachel Gilmore for more tools and information on how to build resilience in your life and specifically in your shoulders. We'll talk soon.